Hello, and welcome back to the Dental Realist Podcast. This is episode 14, and we appreciate you joining us. We have a very special guest tonight that we'll introduce here in just a few minutes, and let me introduce my good friends and co-hosts, Dr. Marcus Neff and Dr. Troy Stevens. Guys, how's it going tonight?
Doing great.
Very well, thanks.
Good. And I am Ryder Waldron, and we are just happy to be back. We've been off for a couple of weeks. We want to thank Howard Ferran from Dentistry Uncensored podcast for having us on last week, and you can look forward to that coming out, I think, in the middle of September is what he said, guys. So we had a great time. We really appreciated him having us on. But let's get to our awesome guest tonight. She is Juanita Benedict. She is a doctor of physical therapy and a certified ergonomic assessment specialist. And chances are she's the smartest one on the show tonight, I'm guessing. But Juanita, we appreciate you joining us. How are you doing tonight?
I'm doing very well, thank you, and thank you for having me on.
You're welcome. We appreciate you joining us. We're going to talk about some of the bad posturing of dentists. We're going to talk about some pain tonight, things that go on in everyday life of a dentist, back pain, neck pain, all kinds of pain. Troy usually says that he can tell which day of the week it is by how bad his back hurts. Isn't that about right, Troy?
Yep. Yes. Today is Thursday.
And
he's ready for the weekend.
I can feel it in my neck and my back.
He's in the fetal position right now. So, well, Juanita, before we get started, why don't you tell us why you decided to work with dentists of all people?
Yeah, I know it might be an odd choice. Dentists have an interesting reputation with their personalities. But my stepfather was a dentist, and my family's actually been in dentistry for over 30 years. When I was in college, I was home, and there was a day when my mother, who was my stepfather's assistant at the time, she wasn't feeling well. So my sister and I got a call from the office, and they said, okay, which one of you wants to learn how to be an assistant? And my sister did not like that, but I jumped right in. I said, me. So I got to train a little bit as an assistant under him, and I worked under a few other dentists, and I really started to realize how physical dentistry was and just how demanding it was in so many different aspects. And when I decided to become a physical therapist, that experience always stuck with me. And I really devoted a lot of my research while I was in school to looking at dentistry and, some of the problems that come out of that. So that's kind of my journey to where I am right now, working with dentists and all types of dental professionals, but that's how I got started.
Great. Well, awesome. Yeah. How many dentists experience pain? I guess what percentage of dentists that you work with actually experience some kind of pain?
The statistics are pretty high. It probably won't surprise you, but the research out there indicates that up to 80% of practicing dentists experience pain at some time in their practice. That doesn't mean that it's always chronic or debilitating, but there's some sort of pain that's experienced just while practicing. And if you look at hygienists, that percentage goes up to almost 95%.
Oh, wow.
So, yeah, it is significant. And even more so in hygienists, but dentists aren't always as verbal about it. They underreport it for lots of different reasons. So getting, good statistics on that, it can be kind of difficult.
We're pretty tough, I guess.
What could that disparity be attributed to?
Well, you mean between the dentist and the hygienist?
Between the dentist and the hygienist, yes.
Well, typically dentists have more variety in their work tasks.
Okay.
Even though their posturing can be the same, you have more, we're going to call them micro breaks or mini breaks during your treatments, to where you're looking at the x-ray or you're reaching for different instruments. And you have some opportunities to increase the blood flow to areas that dental hygienists, once they assume a position, they're pretty much static for a long period of time. There's not a lot of movement, can create a lot of ischemia. Plus, they have a lot of force and repetition, and that can create some trauma in, those specific muscles that are being used. So,
Sure, that makes sense.
Brings up a question for me. When I was first getting out of dental school, I had a kink in my neck and went to a chiropractor, right? Just woke up in the morning and my neck was kinked. I had a friend who was a chiropractor, so I went to it. But when I went to get disability insurance, they asked, do you have any problems with your neck or your spine, all that stuff? And I actually put down, they asked if I had seen a chiropractor, and I said, yeah, I'm not going to lie about it. And they actually put a rider on my disability so that if anything was to happen, or I couldn't practice dentistry because of my neck or my back, because that's what the chiropractor had adjusted, I couldn't get my disability policy. Is that why you see that dentists may not report it as much?
Yes, that's a significant reason. It's reported that, even the disability insurance companies report that 55% of all of their claims are because of musculoskeletal disorders. So that's a huge percentage. If they can, decrease that in any way, then they're going to do that. I'm surprised they don't put riders on, every single dentist. Yeah. But that's a huge liability for them. But that's also why people don't report it. I know when I was doing my research in PT school, when I was out looking for subjects, I had some dentists call me and say, I would be willing to participate in, your research, but this can't go through any insurance and can't have any, names or anything like that associated with it, because there was this fear of that. Plus, also you're getting sole practitioners that are selling their practices to these larger corporations, and they're still staying on sometimes as a dentist with that, and they don't necessarily want that out there, that information out there, that they're, having some pain. So that can compromise what's happening there as well.
I went back, I guess it was 10 years after the initial thing, and I figured, my gosh, it's been enough time. So I went in and had the rider removed from my disability insurance after that, but yeah, I found that very interesting. It's like, man, I didn't realize, and I wouldn't even have gone, it wasn't like a serious thing. It wasn't like, I was in chronic pain or anything. I had a friend who was a chiropractor, so I went and saw him, and then I just told him on the thing. So that's kind of interesting that they take that pretty seriously in your disability policy.
Yeah, it's something that really, young dentists aren't, or, dental students aren't necessarily aware of that when they're first starting out and they're looking for disability insurance. But that's why prevention is so important. Even in dental school, the statistics are staggering there too. 90%, now here's a good statistic for you, up to 90% of dental students will report pain, usually in their neck, back, or shoulders, as soon as they start clinical practice. So that's a significant number as well.
That's very significant, because you figure, if you're going to be practicing dentistry for 30 years and they start out in pain already, that could be a challenge.
Right. Well, no, that number does drop off. There's some discrepancies with the research because, like I said, it's hard to get some of these people to report what's really happening. But it does drop off after a while. There's some theories out there that possibly they just figure it out and they learn how to practice, a little bit more efficiently so they're not in pain, or they just decide not to become dentists because, and don't complete the programs because they don't want the physical toll that happens. There's not really a lot of follow-through that I've seen with the research that tells us exactly what's happening. But it's an interesting trend, yeah.
So is like back and neck pain, are those the most common types of pain for dentists? Because I remember, speaking about dental school, I remember being a perio class, guys, and after we do some scaling on like those plastic teeth, my hands felt like they were just like curled up, like I couldn't stretch them out. They hurt so bad. Now I don't get that as much. But Juanita, what are the most common types of pain for dentists?
Yeah, I mean, it's not surprising that those are the two leading problems with dentists as far as pain goes. Low back is the first, which that actually kind of statistics bear out, but anecdotally, what I see, I don't see that as much in dentists. I mean, I see it, definitely, but I see neck pain as the primary concern. I think maybe people just anticipate as you get older that you're going to have back pain and they don't maybe contribute it to dentistry. I'm not sure what that is, but those are certainly the highest disorders or dysfunctions that you see in dentistry for dentists. Yeah.
I know.
And then shoulders is the second. I'm sorry, shoulders is is the next.
That's what I was gonna say. I feel a lot of pressure in between my shoulder blades and in my neck, kind of with holding the hands up and stuff like that, kind of trying to keep everything lined up properly. Have you noticed that using dental loops helps to decrease the amount of stress and back pain and neck pain?
So it can. So this is a really interesting conversation when it comes to loops, because as I'm sure that you've known, if you've done any kind of shopping for loops, there are so many different types of loops, and they offer all of these different features, and some of them are fantastic, and some of them are not, and some of them work for one person and not the other. There's so many considerations when you look at loops, and they absolutely can improve not just your posture, but just your neck pain and also your visual field, right? That's so important in dentistry. That's actually the key, and it's what cultivates and creates most of this poor posturing. But there are a lot of things to consider when you're looking at loops, which is, things like the weight, how heavy they are, especially if you have, if you're going to buy a couple of pairs for the office, it's really hard. It's not a one-size-fits-all kind of situation. You really need to be measured, and somebody really needs to take time to figure out what's best for you.
I've had, I think all of us, right? I think you guys all use loops.
Yeah.
Yeah, we all use them. I've been trying to get my hygienist. I've got a couple of them that do use them, but there's one or two that do not. And I was just curious as if you, maybe see if that maybe benefit them and helping their posture and whatnot.
Oh, I'm sure that it would. Even if they're ill-fitting loops, there's almost no way that they can't improve somewhat, Right. But the best type of loops to get for dentists are really the kind that have a really good declination angle. That way it allows your neck to stay in a more neutral position. But like I said, there are so many different things to consider when you're looking, not just at loops, but other types of equipment to help you, whether it be chairs or, lighting systems or delivery systems even for care.
We recently bought some new chairs and from ADEC, actually, and the ADEC rep actually took some time. I don't remember him doing this previously, but this rep took some time and went through proper positioning of the patient, proper positioning of the stool that you're sitting in, and I thought it was good advice, and it was helpful.
That's great. I mean, that's so important. That educational component is huge, especially for dentists or anyone that's really invested in what they do. You don't want somebody just to come in and just say, okay, well, you need to sit like this. Your legs, need to be at this angle, and your neck needs to be at this angle. Because let's face it, when you're in the middle of doing a procedure, you're not thinking about what angle your neck is, right? You're thinking about, okay, how am I going to get to this area of the mouth? I can't even see. Can somebody suction here, please? You're not thinking about exactly what's happening with your body, and that's how you end up all contorted, because your awareness is elsewhere. So So that educational component, there's just not enough of it in general for the whole community of dentistry. But certainly I feel like when it comes to ergonomic equipment, that that's lacking. A lot of it is just, you should sit here, do it this way, and it's too much. You can't apply those types of strategies.
Yeah, one size doesn't fit all.
Yeah,
exactly. Yeah,
that's something I just wanted to ask you a question. I have a couple hygienists that like different types of chairs, like operator chairs. Is it important to? I have one particular hygienist who's really, really particular about her chair. But as a business owner, I don't really want to go out and custom get chairs for each one of my hygienists. You know what I'm saying? What would you suggest as far as that goes? Is it worth the money to just have the hygienist working on a chair that she may not be as comfortable on, or is it something that you should just say, well, just go ahead and cough up the dough and get her the chair she wants?
So that's a great question. I actually was just speaking with someone about this particular topic the other day, and I really am actually fairly a minimalist when it comes to equipment, and this is true in my general PT practice as well. Your body is pretty stinking amazing, and it can do things that you're not even aware that it can do. So with the proper education, with the proper cueing, you can really learn to sit in just about anything in a proper manner. So what I'm saying is that you can take, I don't want this to be oversimplified, but you can take a basic chair, do a few adjustments to it, and it may be appropriate, and it might be even more comfortable than these, very expensive chairs. But you have to educate yourself on, proper positioning of not just of the operator as well as the patient and things like that. How many, I don't know if you guys have experienced this or not, but I've certainly talked to a lot of dental professionals who have gone through many, many, many chairs because they're looking for the right fit. And, it's not really, the problem is not the chair. The problem is that they don't know how to control their body. And by not knowing how to do that, then it doesn't matter how many chairs you go through.
Yeah.
So
we just had one, like I say, we've talked in previous podcasts about, keeping some of the costs,
Sure.
within a reason. You don't want to go out and say, okay, hire a hygienist and say, okay, well, let's fit you for a chair.
Right.
So this one particular hygienist, we had one that was upholstered, and she didn't like the way it was upholstered, so we had to have it customized a little bit different. And I'm just like, did we need to do that, or should we have just said, deal with it? But, it's too late now. We did it. But, you want your staff to be comfortable. There's no doubt about that. They, like you're saying, the hygienists tend to sit in the same position a little bit longer than we do because we're up and moving around. So you want them to be comfortable. I just didn't know, at what cost.
Well, honestly, the first thing and the healthiest thing that I would suggest is to really, find out from her what's happening with her body. Where is she hurting? What's going on with her? Is she having pain or is she not? Yeah. It's not so much about comfort. For me, it's really about health. And they usually go hand in hand. But sometimes comfortable positions are not healthy positions.
Right.
So if you think
I can't remember if she was having pain or if it was just she didn't think the chair was comfortable. I can't remember.
Right. Just because, if you think about the way you sit on a couch, right, you're comfortable, but it's so not healthy, typically, the way that people sit on a couch.
If you saw how I was sitting right now, you'd cringe. I'm like hunched over like the hunchback.
Yeah,
it's the same. It's the same thing at work. Sometimes you have to learn to be uncomfortable so that you can maintain healthy, and then that becomes comfortable to you. So it's hard to say whether or not that particular hygienist needed a specific type of chair or not, because obviously I can't look at her to tell you that. But yeah, I mean, there's a lot to consider. It's an expensive venture when you really start looking at the health of yourself as well as your employees. It can be quite costly, and on the front end and on the back end. You know, whether it's missed work, which, by the way, hygienists, that's the number one reason that they miss work is because of musculoskeletal pain, typically. Yeah.
Now, so, when should somebody seek help? I know as dentists, we quite often, tell our patients, don't wait till something hurts. At that point, it's going to be a bigger, more costly procedure that we've got to perform. So what are some points that, at which a dentist or a hygienist should actually go seek some help?
It's so funny that you asked me that question, because one thing I love about dentistry, and I admire so much about your profession, is that you guys are such huge advocates of preventative care. Right. I would say better than any other healthcare industry that we have. I think you guys do such a great job in every capacity preaching prevention, except when it comes to yourselves. So, I mean, you have beautiful teeth, right? and healthy mouths. But when it comes to learning to prevent these musculoskeletal things, I mean, how much schooling and education did you get when you were in school about practicing?
Like zero.
About posturing and stuff?
Yes. Mm-hmm. Maybe one lecture, a couple hours.
Yeah, not much.
Maybe if I don't remember it.
I don't remember.
I remember in a perio class that they were teaching us where to sit to like skill the lower left or something like that, but it was more of where to sit, not how to sit, I guess, if that makes any sense.
Yeah, more positioning around the patient versus your own posture in your chair, right?
Yep,
I do remember that, yeah.
So one of the problems with that, right, is that when you get in the real world, that doesn't always happen because patients don't want to always be supine, and you have to figure out ways to generate that. If you were taught how your body should react and how it should feel in different and various positions, then it wouldn't really matter the position. I mean, the patient positioning is important, but you would be able to understand how far you could push your body before it was going to hurt, before you were going to start having some consequences to do that. But that's a soapbox of mine and some other people, is that, there really needs to be a lot more preventative information while you guys are in school. It's a huge thing. I mean, a lot of reasons that dentists retire early is because of musculoskeletal problems. And if it's not that, the second largest is cardiovascular problems. And the third, just so you know, is mental health issues, which probably isn't surprising. But all of those are related. If you have poor posturing, that absolutely affects your cardiovascular system. And, actually, I believe it was the podcast that I listened to, you guys, the first one that I heard, where you were talking about how you're so isolated, and, you're isolated in this small room, and you're working in such a small space, and you have to be so precise with all of your tasks, and that creates a lot of mental stress, and understandably so. And that, I can only imagine, or I can remember, but not quite. It's been a long time since I was there. But I obviously didn't stick it out, or I wouldn't be a physical therapist now.
Right.
But
you made a good choice, and you did well.
I said, no. I'll treat these guys. How about that?
Yeah. But that's one thing I find difficult, like you're saying, in school they did teach us kind of, how to sit around the patient, how to position the patient, blah, 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 but, like we've talked in a podcast before, some of these elderly patients, they can't lean back all the way, they have to be sitting up. I mean, sometimes you find yourself doing things standing up just because the patient needs to be comfortable when didn't we have one of the doctors in one of our classes tell us that, well, you got to make sure that you don't do that because, your back has to last a lot longer or something like that than that patient. Or what? Do you guys remember that?
No, but that's probably true.
It's like, you guys got to see, patients for 30 years or whatever. That patient's got to deal with, 20 minutes of discomfort. But
yeah.
I have found in my own practice that I would rather my patient be comfortable than myself.
Yeah, I do. I do the same thing, Troy, and it does seem ridiculous. And I find myself thinking, like you said, Juanita, I can't see this tooth. I've got to lean over to see this tooth, and then it becomes easier on the next patient to do the same thing, and then it just repeats itself throughout throughout our careers.
Yeah, absolutely.
Right, and if you were to have learned, a good method for body awareness, then you would be able to understand, what's going on with your body. That's why general exercise is so great, because when you do work out, you gain this awareness of what's happening to your body. You can pay attention to what's happening to your muscles, and you can apply that to work and every other aspect of your life as well. So it's not just to get the endorphins going, which is good too, because it's a great stress relief, but it's also, as we get older, right, and we start to appreciate different levels of things, exercise is also just great so that you can become more in tune with how your body is actually working, because it changes, as we age, things change. So it's important to kind of stay on top of that and know what's happening.
So the three of us, we kind of like to think of ourselves as like these amazing athletes. Troy's a left-handed savant, and Marcus and I are, we're awesome too. But are there sports that are like better for dentists? Like Troy likes to ride his bike a lot. Marcus and I ride too, but Troy rides just a ton of miles. And like I keep thinking, bent over a bike like that with your wrists and hands in one position the whole time, is that tough? Are there sports that are better for dentists as far as the musculoskeletal stuff goes?
Being active is great in lots of capacities. If you're not experiencing pain while you're cycling, then that's great. I would say continue doing that. You may not feel the pain or the issues associated with it right away, though. So let's say you're cycling for, 20, 30, 100 miles. I don't know how much you cycle. I'm a runner, so I run. So I just try to stay out of your way. In Florida, we have to share these trails here. And so,
and Troy will run you down.
He would run me down.
No, I have not hit anyone yet. Yet.
I like that caveat there.
Yep.
But no, I think as long as you're able to get off from your bike and then later in the evening or even into the next day, you're not experiencing any kind of residual little back pain here, little wrist pain there, then obviously that's a great exercise for you. And I would imagine that it provides you with a lot of stress relief, which is so important when it comes to pain. So,
Yeah, that's true. Yeah, I think that in some of that respect, as long as you have your bike set up properly, get a proper fit and things like that, it seems to help. Because I know some cyclists do have problems with lower back pain, if their seat's not in the right spot or whatever. So that definitely can add to it. Ryder, you're a basketball player. Is basketball an okay sport for building the muscles and stuff that you need?
Are you asking me?
Yes.
Or
Sorry.
Don't ask me.
Sorry, I was asking you. Thanks, Juanita.
No, basketball's great. You have a lot of cardiovascular fitness that's required in order to play basketball. You've got a lot of running, jumping, so a lot of stretching the muscles. Any kind of cardiovascular exercise that you're doing is really just improving that blood flow, which is really the problem in dentistry when you're in that posture, that prolonged position when you're bending over to do something that you're not supposed to be doing. It's really creating ischemic muscles. So it's decreasing the blood flow to those muscles. And when you're able to really get out there and do any kind of exercise that improves that blood flow, that's great. You know, it's really going to help you to stay more stable, or to keep that more stable as you practice.
Now this is Marcus. I'm an ultimate fighter.
Okay, awesome.
I don't know.
Wait a minute, I think I saw you on TV the other day.
Yeah, he's on pay-per-view.
Oh, okay.
But not for ultimate fighting.
Okay. Okay, so you're an ultimate fighter. You might want to be careful with that.
Okay, yeah. I'm missing some teeth, you know. So it's not a
big deal.
Oh.
That's funny.
So, Juanita, I am not a real touchy-feely guy. Like, I've never had a massage before, and my wife always tells me, you really need to get a massage. It makes you feel so good. And are massages helpful for dentists? Does it really help? Marcus, you like a hot stone massage yourself, don't you?
I have had one.
Yeah.
Yes, I have. And it is wonderful.
Yeah.
So massages are great.
Are they?
They're fantastic, but they're temporary.
Okay.
So you'll feel great for a couple of hours, maybe even a couple of days. But, you know, first you have to be very consistent with it, once a week, once or twice a week, in order to get any kind of a real benefit from it. But then, you know, the purpose of a massage is to improve blood flow, which is great. We just talked about that. But, you know, it's also to decrease the abnormal tone that can build up in muscles that are, you know, tight. And that's great if you could just get a massage and then go to the beach for a couple of days, then it would probably last longer. But if you have developed these habits and postures that are kind of built into the way that you work, once you go back into the office, then that's gone. You know, all of the benefits of a massage, they're pretty much gone, because you're going right back. And those muscles, once you train them, just as you can imagine, like your bicep muscle, if you lift weights and keep lifting weights, it doesn't take very much for that bicep muscle just to pop into place and you show your guns to everyone.
Marcus does that.
That's what he does. Okay.
All his pages.
Sun's out, guns out.
That's right.
My motto.
But the same thing happens to abnormally toned muscles too. So if you've got, let's say, your scalene muscle or your anterior, your scalene is tight. Once you start to move in position, it's ready to go because your body is very efficient. It wants to be efficient. And even you can train it to do really crazy things. And once you train it, then you have to untrain it in order for it to really be effective.
This is Marcus again. So we hear often of people going to the chiropractor, people go to a massage therapist. It doesn't seem like very often we hear people going directly to the physical therapist. Is that possible? And why isn't it that we hear people going right to the physical therapist when they have an ache or pain?
Now, see, that's a dangerous question, Marcus, because that's a very political question. Truthfully, it really is. But we won't get into that. A lot of people don't know. They just kind of assume that you have to get a referral from a physician in order to go to a physical therapist. As you know, once you get into a certain level of providing health care for people, you become more educated as to what that is and what that looks like.
Right.
And a lot of dentists treat themselves. You know, they medicate themselves if they have pain. They don't really like to go to dentist, or not, I'm sorry. Maybe you don't like to go to dentist either. I don't know.
We hate dentists. Just like everybody else. We hate
But they don't like to go to doctors. They don't like to go to doctors, and because, you know, why do I need to go to the doctor to write a prescription for something that I can look on YouTube and get exercises for, right?
Right.
And I think that people don't really know what physical therapy can do, and I think that they don't know that you can go to a physical therapist directly in all of our states. It's called direct access, And in all 50 states in the United States, this is actually a new thing for some of these places, that you can go directly to the physical therapist without having to go to the doctor first.
Wow. Yeah, I wasn't aware of that.
Now, sometimes, there are some limitations on it depending on the state that you're in. So some states say, well, the physical therapist can take a look at you, they can do an exam, but then they have to send it to a doctor to get signed. Or, there are different stipulations depending on the state that you're in. But, so it's a hidden, physical therapy, we're just not as vocal as a profession as we need to be. Mm-hmm. Because physical therapists also have a personality traits about them. And it's not, it's good. I feel like it's a good one, but it's definitely not the typical type A personality that
the physical therapy lobby isn't as...
It's not as strong.
Lobby isn't as strong.
It's not. And so we've actually gotten a lot of things taken away from us, from our scope of practice because of that very thing. But so anyway, but physical therapists are pretty amazing. I mean, there are some really fantastic physical therapists out there that can help in a lot of respects. If you do choose to go to a physical therapist to help, there are some things that I would suggest that you look for, because not all physical therapists are equal, right?
Right.
So one of the things that you want to look for, they're all going to treat you for your physical condition, right? If you go in and you say, oh, my neck hurts, they're all going to say, okay, well, let's take a look at your neck. But if they're not asking you what you do for work, how you position yourself, how you position the patients, if they're not asking you how many times where your instruments are, where's your lighting, if they're not asking you at least those general questions, then you may need to scout around for someone else who can really understand what you do, because it's extremely important that not just your physical body gets attention, but also that you understand what's happening in your environment, as well as that psychological state that we were talking about with the stress and whatnot, and learn how to manipulate all of those variables so that you can be successful. Because if you only change one, and you go right back, then it's not necessarily, it's going to be somewhat successful because you'll have some tools in your belt.
Right.
But it may not be as successful as it could be if you had gone to someone who had a broader understanding.
Now, Juanita, you're in Florida, is that correct?
I am, yes.
Yeah, so clearly you have kind of that broader understanding and can provide that type of care to a patient. How would somebody in Idaho, for instance, work with someone like you in Florida?
Well, if you want to work specifically with me, I actually, I'm trying to branch out because there's really there's not enough of us, the physical therapists, who really look for this broad perspective, who really share this broad perspective of what's going on. There are a lot of them, but not enough, and not that many that are interested in dentistry for some reason. I don't get that at all. But I think that, with technology today, there's a lot of ways that we can provide services that aren't necessarily hands-on.
Sure.
So I'm kind of tooling around with that. I would really like to start maybe doing some virtual type of consultations and things. But if you wanted to get hooked up with a physical therapist, what I would look for is an ergonomic assessment specialist, and I would also look for a physical therapist, of course. But if you had those two things together, then you're going to find somebody who has a pretty good grasp as to what's going on with you in your job.
That's great advice.
Yeah, that is. And Juanita, I was looking at your website, which is healthydentistrysolutions.com, and I read several of the blogs on there, but the one that really jumped out was called Optimizing Your Health with Optimism. And I think people call me a pessimist, I consider myself more of a realist, but I'm definitely not an optimist. And I don't know how Marcus and Troy would describe themselves, but talk a little bit about how having like an optimistic outlook really actually helps, in dentistry with stress, with physical pain. And is it possible just to like all of a sudden say, I'm going to be optimistic and think on the bright side?
Okay, let me answer the latter part first. I think that no. I think it's unrealistic to say all of a sudden you're just going to change and become an optimist. I mean, I guess that there are those, come to Jesus stories where people do that, but I think that it's a journey. And I think once you start, there are lots of different things out there. Talk about journaling and meditating and all of these, and I advocate that. I think that that's great. But it's really cultivating this attitude of gratitude. So if you start being grateful for just the small things, I'm so glad I had my coffee this morning, and maybe that's the only thing that you are thankful for and grateful for that day. But then every day that becomes something that you look forward to and something that makes you happy in that moment. And the more of those moments that you kind of grab throughout the day, I think the more you start to see your attitude changing. I do think it's a journey. I don't think that anybody just wakes up. I mean, you probably have your days where you wake up and say, oh, it's going to be a great day. The sun's shining. It's so fantastic. But I think, personality-wise, that it really takes a little bit of effort on your part initially. But then your brain rewards that. So because, of course, it creates all these good sensations and endorphins and all of that. So then your brain starts to crave more of those opportunities, and you start looking for those opportunities more than you start looking for the negative ones. Now, how that relates to dentistry is very interesting because there's a lot of research on pain science now. I don't know if you have read a lot about it or not. But it talks about your perception of what's happening really determines the level of pain that you're going to experience. So your body's just so fantastic. It's just really brilliant. But your brain can activate your pain system before you even do anything that would even cause you to have pain. And I'm sure you guys experience this with patients. As soon as you walk into a room, they're hurting even more just because you're in there.
Right.
And it has nothing to do with you. They're sitting in the same position they were 2 seconds before you walked in. But it's just the fact that they're already experiencing pain. And it's real. It's real pain that they're experiencing because that's all in the brain. But they're doing it through this, perception. So it gets a little deep, and I'm a little bit of a nerd about it, a lot of a nerd about it. But I think it's just amazing. There have been studies that show that, people, they'll put lotion on your hand, same lotion. It's just very, nondescript lotion. And one of them, they'll cue the people and they'll say, okay, this is going to burn. It's going to probably be painful. And they'll put the lotion on, and even before they put it on, they are already experiencing pain. And then, for other people, they're going to be like, no, this is going to be so good. It's going to feel great. It's going to feel cooling and relaxing. And that's exactly what people are feeling. So, you have to prep your brain. And if you are optimistic and you're looking for the positive things that are happening in your life, instead of focusing on reality or the negative parts, then your brain is not going to be so ready to experience that pain. Does that make sense? I mean, that's kind of a long way around that. But
that does make sense. Yeah. Mm-hmm. Yeah, that does. Yeah, thanks.
But there, we talked a little bit earlier about, YouTube videos or whatever, showing different exercises and things like that. Are there any in particular that you would say are really good specific to dentistry, that strengthen those muscles, different types of stretches, exercises?
Okay, so I have to caution you on the YouTube thing. I said it because I know that that's reality, right?
Yeah,
people do that.
People can do their own dentistry now because they watch the YouTube video.
Do you know what? I'm not lying when I tell you that I had a patient the other day. He has a prosthetic leg, and it wasn't fitting quite right. He said, I'm just going to go on eBay and order this one that I found there.
Yeah, that'll be nice.
And he said, I watched a YouTube video on how to fix it, myself.
Oh, wow.
I'm like,
Yeah.
I said, okay.
Maybe that's made everybody doctors,
Exactly.
Yeah. I'm sure people have already tried to do their own eye surgery or whatever now.
Wow.
So I have to caution you about that, and that's another one of my projects that I've wanted to work on, is to put together, actual quality evidence-based exercises that can safely be done with, all of the precautions and things, in there, so that people understand what it is that they're aiming for. Because you get some people on there who don't know what they're talking about, and they go, and I've seen it. This is a great exercise for dentists. And I watched them and I said, oh my gosh. Not only is it, it would be great if you're, 25-year-old marathon runner, fit, awesome guy, but if you're experiencing pain, it's not going to be comfortable. But there are certainly exercises that can improve pain. There's a great book. I'm going to plug her book because she's fantastic. Anyway, she's a physical therapist. You may have heard of her, Bethany Valahi. Have you heard of her?
No.
I haven't. Do you have her last name spelling there? I'll take a look.
Sure. It's Valachi.
Okay.
And she has a book called Practice Dentistry Pain-Free. And she's a physical therapist. And she's out west there. She's out by you guys. And that is a very good and practical book on some exercises. And she goes into quite a bit of depth she talks about, different equipment and loops and positioning, and she's got lots of good information in there. And it's a pretty quick read, but it's one that you can, flip to if you just want something specific too. So it's a great, really good book. So I would recommend, if you're looking for exercises, don't just go on YouTube. Spend the, I don't know how much it is, a couple bucks, $10, $15 to get something that from somebody who actually knows what she's talking about.
Sounds like it'd be well worth it.
Yeah, that does.
Yeah, she's fantastic. And her website is posturedonics.com.
Oh, wow.
So you can go on
Pretty
there
cool name.
and look for her. Yeah, she's very cool. We may, we'll see what happens in the future. She's a great.
Posturedontics.
So, Juanita, when, at least with me, and I'm speaking for Marcus and Troy too, but like when I see somebody take like a piece of tape or string or fishing line and just tear it with their teeth, it makes me cringe. What do dentists do that just totally make you cringe when you see their posture or activity, anything like that?
You know what? It's really actually a question that they ask me. Every time I see someone, they, for almost always, the first thing that they ask is, what stretch can I do to make this feel better? And I don't know of an equivalent to dentistry, but what that tells me is, of course, that they don't really understand what's happening with their body, because it's not really just that your muscles are tight, but they're weak and they're dysfunctional and they're not working properly. There's probably a lot of muscle imbalances. Maybe maybe it's equivalent to like perio disease or something like that, you know, where people think, oh yeah, it's just a little sore, but you see it and you go, oh my gosh, that's a disaster in there.
Yeah, it's like when they show up with an abscess and they say, well, rinse with a little warm salt water and some peroxide. It seems to be going down. Maybe it's something like that,
or some Clorox.
Yeah, some Clorox.
Well, you know it does clean.
There you go. But yeah, I mean, so to me, it's just, and it's okay that there's not an understanding. That's completely fine. But I think it's more that they think that they know. You know, if you think that you know, then the stretch is going to be okay, and I just need to stretch my neck more, then, you know, that means that that kind of makes me cringe, only because I know that there's a lot of work ahead, you know, educating people, which is fine. That's what I do. And I like to do that and really bring people into the complexities of what's actually happening.
I don't want to open too big of a can of worms here. Just a quick question on your side. What is the relationship, or what is the thought behind, or how do physical therapists feel about chiropractics? Do they feel it's beneficial, or is it kind of, you know, counterproductive?
So, you know, chiropractic care and physical therapy care, we came from different starting places. Physical therapy grew out of the medical model, so we've always treated in a very medical capacity.
More scientific based versus like a...
Well, I mean, I'll be honest with you, it's only in the last, 15, 20 years that physical therapy has really been out there producing the research that they need to do in order to really validate what they're doing. But, because, before that, it was just common sense. This only makes sense that this would work. And it did work, but we didn't really know why. So now we're really getting some research out there and behind us, which is great. Chiropractic care grew out of a different, and I'm not going to speak a lot to it because I'm not extremely familiar with the beginnings of it, but it did not grow out of the medical model. It was an alternative to the medical model. So their approach is very different than physical therapy.
It seems like it's more holistic, like you align the spine and other parts of your body will start working right, kind of thing, I guess. And there may be something to it. I haven't done any, real in-depth research about it. My wife will swear by it. She loves going to the chiropractor. She's got a chiropractor that, helps her get out of pain all the time. So I was just curious as if there was any overlap, if like you work with the chiropractor, say, they do some, skeletal alignment and then you work on the musculature or anything like that. Is there any of that crossover type stuff?
I would like to see, honestly, more of that, although physical therapists, physical therapists are trained in how to do manipulations. They're mobilizations is what we call them. They call them manipulations, and there are reasons for that. But we can certainly, crack backs and necks and everything else too. Some of us are very, very, very well trained to do that, and then beyond that, we put together an entire exercise program to support what we just did. So again, if those muscles are trained in a poor capacity and you fix the spine, it's only going to be just a matter of time before those muscles pull any kind of alignment that you just created back to the original position, because that's what the job of the muscles are, right? To move the bones. So if they're if they're not working properly, then that's what they're going to do. They're going to keep pulling that out. So you have to not only align the spine properly, but also support that with the proper structural, rehabilitation that needs to happen.
Yeah, that's cool.
Mm-hmm.
Well,
just curious.
Well, Juanita, we really, really appreciate you joining us tonight because this has just been awesome information. I think you guys would agree. This
Absolutely.
has been just great. Why don't you tell everybody where they can find you online, how they can get in contact with you, if they need a consult, tell them about your website. Just really tell everybody how to get in contact with you.
Sure. Okay. Well, you can certainly start at my website, which is, you mentioned before, it's healthydentistrysolutions.com. There is an area under the consultation tab that you can just drop me a line. If you just have a quick question you want to ask, or if you're interested in being a guinea pig for a virtual consultation, then I'd love to get any kind of feedback or any kind of questions from people. So that's the best place to start, is my website. You can always join me and connect with me on LinkedIn. I'm on there as well. So I enjoy, reading about all the different things that's happening in dentistry and how that applies to what's going on, in the chair and other things as well. So that get some information from LinkedIn, and some great contacts there as well. So you can join me there. Those are probably the two best places to get in touch with me. But at least for now. Now I'm starting my own podcast, guys. So,
cool.
Yes.
Good.
Yes.
Good for you.
That's awesome.
So it's gonna be basically, this is gonna be the format. I'm gonna have some people call in and just ask questions,
Cool.
1 or 2 questions, and then I'll do a 10-15 minute, expansion and educational part of to answer that question. So
wow, that's great.
That's in the works.
Very nice.
Yeah, that's really cool. You'll have to let us know when that gets up and going so we can let our listeners know. And yeah, everybody really should check out Juanita's website, because it does have awesome blog articles on there. And the great thing about them is they're interesting, first of all, but they're real concise. There's not, you can read them in just a few minutes and get a ton of information out of them. So I hope everybody will go check that out. Marcus, why don't you tell...
Thank you for that.
You're welcome. Marcus, why don't you tell everybody where they can find us and get in contact with your amazing body?
I don't know where you're going with that. Anyway,
I think it's the whole MMA thing,
Yeah.
Oh, okay.
Everybody thinks in their mind they're thinking you're ripped.
Anyway,
He is ripped. He's an army captain. Of course he's ripped.
I'm a major.
True.
Sorry.
Major, sorry.
Yes. Anyway, where you can find us? You can contact us through our website, www.dentalrealist.com. We also have a Twitter account @dentalrealist, Facebook page. You can reach us on LinkedIn. We do have a couple of books that we've written that are available. So You Want to Be a Dentist and So Now You're a Dentist. Both can be found on Amazon.com. Digital download. Our first book, So You Want to Be a Dentist, is available in print copy also through lulu.com. You can find us on iBooks, a variety of places. We love to hear from our listeners, so please reach out to us and let us know if there's anything you'd like us to talk about or any questions you might have.
Yeah, and we appreciate everybody listening and tuning in, all the support we've gotten. And we will be back with episode 15 on the Dental Realist Podcast. Thanks a lot.